is Eric Kimondo, and today we are so honored to have with us in studio Dr. James Kyama, who is together with us to tell us about how to protect our eyes and to prevent sudden or gradual blindness. We know the eye is the light to the body, and it is rightful to take care of our eyes, and we know this episode is going to be of a great blessing in our lives. Karibu sana, Mr. James. I'm going to give you this opportunity, first of all, to say hi to your friends, to your family, to your colleagues, and then we shall proceed.
Okay, thank you so much for this, for having me on the show. And I'm also grateful for having this opportunity to share condition of the eyes and how to manage them. And thank you also for giving this opportunity to also to say hi to my family, my two brothers and my sister, and also my dad. Yeah, I'm sure they are watching, and the rest of the family members, the relative, wherever they are, my friends, I say hi. And may God continue keeping you and showering His blessing in our lives. Thank you so much.
Wow, amazing. Tell us briefly about yourself. Who is James Kyama? Na ikawaje ukakuwa daktari?
Yeah. Thank you so much. I was born in Thika, Thika town, and raised in Kiambu town, where most of my schooling has taken place. And I went to school in Kiambu Primary School.
Wow.
I later joined Kijabe Boys High School, and from there I passed my KCSE very well, and joined the University of Nairobi, where I pursued the Bachelor of Science in Nursing, and currently I've already finished on ophthalmology course, from PCA Kikuyu Hospital.
Wow.
So I'm very grateful for the far that the Lord has taken me. I just bless the Lord for this.
Wow.
I would also want to encourage one or two people out there. They should not give up. They should work hard, especially the young people. They should work hard and focus their eyes unto Jesus, because that's where their true and the solid foundation is. That's where their help comes from. And so far, I can say the Lord has been good.
Wow.
Yeah.
Amazing. Even to hear of that testimony, watu wengi, na it's not stereotyping, hawajui madaktari wameokoka.
Yeah.
Ajua tu, kaba.
Yeah.
We bless God because of your testimony. And the journey that you have walked with God so far, it is it's encouraging to us this morning. Now we are talking about the condition of the eye, both the physical and maybe also the way we protect the physical. We can also carry it through even to the spiritual.
Exactly.
Tunaangazia hayo mambo yote. And we start by telling us which are some of these eye diseases and their treatment.
So number one condition I will be talking about is refractive errors. Refractive errors, there are quite a number. And I will start with the condition called myopia. Myopia is a condition that you find the person or the person suffering from this condition is not able to see objects or images which are very far. Is appreciating images which are very near. And in such a condition, there's treatment, and the prescribed treatment usually is the lenses, a lens called concave, that allows the light to be to diverge and to be focused on the retina. Retina is usually the part where the image is formed, before it is taken to the brain for interpretation. So we find in this patient, with this person with the myopia or suffering from short-sightedness, the image forms before the retina. So it doesn't form on the retina. So the glass that is called the concave enables this person now to be able to appreciate objects which are very far, and that's one of the prescribed medication that we give. The next condition is called hyperopia. Hyperopia is a condition that usually you find a person is able to appreciate objects and condition or images which are very far, but is not able to appreciate images which are very near. So because of this, the treatment is usually we give lens that is called convex, that is able to divert that image to the retina, where the image is formed, and that person is able to appreciate objects which are near, because that's the prescribed medication. And we have another condition called astigmatism. Astigmatism, we find we have a distorted image. You find the image, instead of forming directly on the retina, some part of the image forms in front of the retina, and the other part of the image forms in the at the back of the retina. So there's that distortion of that image, and it becomes blurry. So the person is not able to see that image very clearly, and there's a treatment for it, and it is called cylindrical lens, whereby you are able to focus that image clearly on the retina, and the person is able to appreciate different images. We also have another condition called presbyopia. Usually this is a condition affecting mostly people above the age of 40. And we find in such a condition, you will notice people at that age, mostly above 40, they are able to appreciate image. For example, at a certain length, they are not able to appreciate images which are just nearby. For example, even if the person is reading a book, is able to appreciate that book or that writing or that article. Naeka pale mbali. So you find even when that person is reading the Bible, is reading at that length. But I'm happy that we have a treatment for it. We have readers classes that they are given, and they're able to now read the Bible or that article at close range, and they're able to receive that treatment.
But isn't 40 too early for such kind of a disease?
Statistics shows that presbyopia usually at 40, that's when the condition now starts developing. So from 40 up to the age of 50, 60, 70, 90, 100. So the condition continues getting worse, and it's very common in our society.
Wow.
The next condition, I think I have a number. The other condition is about cataract. Cataract condition, that is, we found it usually affects the lens. The lens usually is transparent. It is inside the eye. It is transparent to allow image to focus clearly on the retina. But cataract causes the lens to cause cloudiness, and it becomes opaque. So the image is not able to be focused on the retina, and that person is totally lost that sight, and becomes blind. But we have a treatment for it, which is usually a surgical removal of that cataract, and in place of that cataract, after removal, intraocular lens is inserted there, to allow now that image to be focused clearly on the retina. We have also another condition that usually now increasing, and it is affecting many people, especially in our generation. That is called diabetes retinopathy, a complication that manifests itself in the eye as a result of prolonged duration of time after person having been diagnosed with diabetes, and also when the person also we find the person is not able to control the blood sugar properly, and in such situation, you find the retina, the part that is responsible for image formation, it is affected, and we start developing intraretinal microvascular abnormality. These are just generally abnormal blood vessel. Because they are usually abnormal, they form rapidly, and they also bleed rapidly because they break. They are usually abnormal, so they bleed and cause something we call vitreous hemorrhage. Yeah, this vitreous hemorrhage is now the one that occludes the retina, and the image is not able the image is not able to be located or to be formed in on the retina side, and because of this, you find it is one of the gradual cause of onset of blindness, especially for those people with the diabetic mellitus. Yeah, so with the time we find the person goes blind. But we have treatment for it. Yeah, we have there's a medication that usually administered in the eyes. Yeah, that allows or stops the growth of that abnormal blood vessel development in the retina. So we have that medication, and we have also, in case of advanced stages of diabetic retinopathy, where now you find the blood vessel, they have proliferated, they have grown and covered most of the retina. We have a surgical intervention that is performed, but by a vitreoretinal surgeon to try to make sure at least the person is able to gain sight. Yeah, no matter how small is it. So that's a correction for diabetic retinopathy.
Wow.
Some of the ways of ensuring that we are able to manage some of this condition is ensuring that a person with this condition of diabetes mellitus is able to do proper physical examination, and is also able to take a diet according to recommendation made by his or her nutritionist, and also ensuring that you take medication as planned. So that is one of the causes. Wow. And it has also increased because of the increase of the fast foods that people are now consuming. So they end up developing diabetes, and this is one of the complications of the eyes. We call it diabetic retinopathy. Yeah. So we also have another condition that they're quite a number. I'm just trying to summarize them. Yeah, so that people are able to know that there is a treatment outside there that can be prescribed and to reduce this gradual onset of blindness. Yeah, we have a condition called glaucoma. This is where there is damage of the optic nerve. Yeah, optic nerve is the nerve that is very important for transmitting visual information from the retina, which is inside the eye, to the back or to the primary visual cortex, which is in the brain, for interpretation. So the moment the optic nerve is damaged, and you find that communication is not there, so the person goes blind. So, and one of the risk factors is increase in intraocular pressure, which is fluid pressure that is in the eye, especially in the anterior segment of the eye, and because of that increased pressure, which is now manifested in damage of the optic nerve. Yeah, so That's quite a number. And I will finish by concluding by the last one, which is very common, and it is a condition called strabismus. Yeah, strabismus, where you find, in layman's language, you call it squint. Yeah, we find the eyes sometimes is looking inwards. The two eyes, they are looking inwards. So in such a condition, we usually call it esotropia. And in there are other occasions when the eyes are looking outwards, in a condition called exotropia. And we find most of these conditions, we have treatment for them, especially when a parent identifies that his or her child has that squint. It is good that you visit an eye specialist, where that immediate care can be started. A procedure called patching, where one of the eye, one of the affected eye is occluded, and allows for the other eye to function or to fixate or to look, to avoid another condition that is usually associated with it, called amblyopia, a lazy eye, whereby because of prolonged straining of the affected eye as a result of this strabismus or this squint, the eye, after straining for quite some time, it ends up giving up. So instead of appreciating visual stimuli, it ends up giving up, and the communication between that eye and the brain is disrupted or completely destroyed, and the eye becomes lazy. We call it the lazy eye, because now it is not able to respond to the visual stimuli or light stimuli. Yeah.
Wow, that has been profound. Getting into this, the problem with us Kenyans is last minute rush. And how would you advise someone out there on the way forward when they identify maybe they have a condition with eye, maybe haoni mbali venye ilikuwa naona before, ama siku hizi anaona akiwa karibu. We have a tendency of just brushing it off until it is too late, maybe. What would you tell people about that kind of condition and how to rectify it?
Yeah, the medical or the recommendation that I can give to such people is to seek medical attention early, before it is too late, because the earlier the diagnosis is made, the better the outcome. So we'll avoid the last minute rush or late diagnosis of such condition, and which can lead to blindness. So it is important, the earlier you come for checkup, the better for you, and you're able to save your sight. Remember, this is a gift that God gave you, so it is good also to ensure that you are able to take good care of it. Yeah.
There's a perception eye care is expensive, so mtu anasikia miwani ni 8,000 ama 10,000, check up maybe ni 3,000. Can you break down into that perception that is in the public and you tell us maybe, do public hospitals have these eye clinics? Is it easy to get eye medical assistance, maybe at even a cheaper price? Maybe do these facilities exist even in the government?
Thank you so much. So yeah, I would like to tell our viewers, help is there, especially, let me say, about the Kiambu County government. Yeah, we have a program called Visual Impact Program, that is very that is the county government is sponsoring, and it is reaching many people many people are able to access these services. So when it comes to cost, now we can't say about cost because now even we can see county governments, for example, the Kiambu County government, and in partnership with the Kikuyu, PCA Kikuyu Hospital, and another NGO called CBM, and together with the MOH, they organized outreach. Yeah, so uh, which visit different areas in this county, and people are diagnosed, and they receive those glasses for free. Yeah, even the medication, they receive those medication for free. So I think so the issue of cost sometimes should not be the hindering factor. Hindering factor. We have also a government facility like a Deka Level 5 hospital. Yeah, it is also offering those services, eye services. You can just visit that place. We have eye care services. And we have also PCA Kikuyu Hospital. They have those services and many other facilities. So help is there. So take the initiative, and when you have that eye condition, ensure that you seek the relevant medical care, so that diagnosis can be done, and the best treatment can be commenced, as soon as possible. Yeah.
Wow. Which population is at risk of acquiring eye diseases?
Yeah, let me say everyone is vulnerable to acquiring this eye condition, but there are those conditions which require close monitoring. And the one that you have already mentioned, like diabetes mellitus, is one of them. And also hypertension is another condition that also can bring complication in the eye. We have also another complication, a disease called sickle cell disease. That also can bring a complication in the eye because of the sickle-shaped red blood cells that sometimes can lodge on or hook on the walls of the retinal blood vessel and cause damage. We also have another condition like people suffering from condition like multiple sclerosis. Which also can affect the condition of their optic nerve and cause inflammation. Inflammation is just that swelling and causing the nerve not able to transmit that visual information to the brain. But generally, we are all vulnerable. We are all vulnerable to getting injury to the eyes as a result of trauma, as a result of vegetative matter, injury to the eye, and also another population that is likely to also get some of these increased condition of the eye that can lead to blindness is like the aged, like people above 50, 60 years, because of the what we call age-related cataract, age-related cataract, which is as a result of aging of the lens. Yeah, so causing that blurry vision and the opaqueness, hindering the formation of image on the retina. So majority of us, we are in that area. Yeah.
What are systematic medical conditions?
Some of these systemic medical conditions, we have already talked about them, but some of them which are also very important, and it is also a wonderful opportunity to emphasize on them, like the diabetes is one of the leading causes of the complication of the eye, and hypertension. Yeah, so when a person or a client who is having those conditions and other systemic condition like the sickle cell diseases, it is essential to ensure that you visit eye specialist for examination of the eye and retinal examination, so that a proper diagnosis can be done. And if a certain condition is identified, treatment can commence immediately. Yeah.
Wow. What is this intraocular pressure?
Yeah. Thank you so much. Intraocular pressure, that is pressure within the eye. Yeah, you know, the moment you mention the word pressure, most of the people understand it like the blood pressure. Yeah, so we have also pressure in the eye that results from a fluid called aqueous humor that is usually produced in the anterior segment of the eye, and it also drains in that segment of the eye, anterior segment of the eye. So when there is accumulation of that aqueous humor or that fluid in the anterior segment of the eye, increasing the pressure inside the eye, and that's why we call intraocular pressure. We have the normal one, which ranges between 10 to 21 millimeter of mercury, but we also have the increased levels of intraocular pressure, which is not very good and can damage a person's eye.
What age should one get this pressure checked?
Yeah, thank you so much. I would recommend people above the age of 40. It's highly recommended that they do regular checkup of intraocular pressure, because past that age, you find there's tendency of intraocular pressure to increase, and which also leads to damage of the optic nerve. And as we have seen, optic nerve is very essential for the visual transmission of visual information from the retina to the brain. So unless a person goes for checkup to ensure that they are monitoring that intraocular pressure, that person is vulnerable to acquire a condition like glaucoma. Yeah.
Wow. Are there eye diseases and sicknesses that are genetically passed on? Maybe unapata in a family, from the parents to the children.
Thank you so much. So there are conditions that they are genetically people are genetically predisposed, and one of them is like keratoconus, and quite a number of them, and we find when or even myopia or short-sightedness or hyperopia, long-sightedness, you find some of them, they can be passed from one generation to the other. So, but the best thing is to know that there's medication for them, there's treatment for them. So the moment you realize some of these conditions, they run in your family, and it is also very important to seek medical intervention early. You do proper eye screening, so that you can rule out, or you can be able to identify at what stage that condition is at, and stop it at there, and start medication immediately. Yeah.
Wow. Just before we take a break and we come back, you continue expounding for us the preventive measures so that we don't suddenly fall into blindness or gradual blindness. Just this is for people that work in, I would call them hazardous or environments that, for example, have a lot of dust. So kuna watu macho yao inakuanga white na kunao tunaonanga spots za brown ndani ya macho. What is the difference? What is the problem? And can it be white again?
Yeah, thank you so much. So yeah, some of this condition, it is good because you come early for diagnosis, because they present some of them, they may present like a different condition, but the moment you come for diagnosis, we're able to investigate further and make a clear diagnosis of whether that condition requires ocular treatment that you can be given and to apply when you are at home. Yeah.
So for someone, for example, that works in a dusty environment, and often maybe in the evenings they complain that macho yangu inauma. Do they need to visit a hospital, or it's a condition they can buy and counter drugs? I think the ones, the liquid, I don't know its name, and they are okay.
Yeah, I would recommend those people to visit eye care specialist. Yeah, because now I can relate that question with a person who is suffering from allergic conjunctivitis, where the person is allergic to that dust, and because of the nature of his or her job, ends up coming into contact with that dust, and because the eyes they are allergic to that dust, they react. Yeah, they react. So the eye react by being itchy, and you find that person scrubbing the eyes most of the time, and the eyes sometimes also changes color, becomes red.
Oh,
Yeah, becomes red because of that inflammation. It is essential that the moment you come to an eye specialist, we're able to give you medication, anti-allergy. We give you artificial tears that you can go and apply at home. Yeah, and we also give you artificial tears is
crocodile tears.
crocodile yeah, that you can go and apply at home. We also we can also give we can also prescribe anti-allergies that also can enable you to reduce the inflammation. But generally, we usually recommend such people to avoid those allergic environment, avoid that dust if it is necessary, so that you can avoid that allergic conjunctivitis.
I'm over goggles.
I'm over goggles. Yeah, something exactly to protect your eyes. Yeah, from such dust.
Talking of the healing, the eye itself, is it self-healing? For example, there are soaps that we use at homes, na saa ingine accidentally maybe you touch your eye with that soap na ni chungu, but you clean it with water, unapanguza, maybe hiyo kitu inapotea after some time. Will it have effects later in your life, ama wakati imeacha kuuma it is now good?
Thank you so much. So I would recommend in such scenarios or such situation, it is essential that the moment that soap gets in your eyes, make sure you use a lot of water to wash it out. Yeah, because generally the eyes they need a clean environment. So at the moment the soap gets into your eyes, that's why the irritation comes from. So it is good to make sure that you use a lot, you apply a lot of water to wash that excess soap. Yeah.
Just right about now, doctor, tell us, for people that we treat ourselves, unajua Kenya tuko na madaktari wengi sana, especially Google doctors. You go through something, even your eye maybe iko na shida fulani, unaingia kwa simu, una type your condition, alafu Google inakuambia hivi na hivi, unaenda kwa counter, unaitisha kadawa fulani. In short, unajitibu. Are there side effects to this?
Yeah. So thank you so much. So I would take this opportunity to discourage people who usually go and prescribe medication for themselves without even consulting or visiting a medical doctor or a clinician for that matter. So you find some of these people, for example, a drug like prednisolone, which is regularly abused because it is an anti-inflammatory medication. Because of that effect, many people just want to take it so that they can reduce that inflammation, either because of an injury or because of a certain allergy they want to treat, and they enjoyed the outcome. So instead of going back to the doctor, they go over the counter to a nearby chemist and buy those medication, which later ends up because of that prolonged use of that medication, like prednisolone, it's end up damaging their eyes.
So you discourage that.
Yeah, causing condition like glaucoma.
Okay.
Yeah.
Wow. Let's talk about children now. For parents with children of less than 5 years old, how can they prevent childhood blindness?
Yeah, thank you so much. So for parents with the children that are below 5 years, it is very essential and very important to take those children for full immunization, to receive vaccines like measles, rubella, because we have seen conditions like eye condition which are caused by rubella virus. So it is essential for that parent to ensure that the child receive that measles, rubella at 9 months and also at 18 months. And it is also very important to ensure the parent also ensure that the child also receive the vitamin A at 6 months, and from there every 6 months up to the age of 5 years, the child is supposed to take that full dose of vitamin A therapy as according to their schedule. So it is highly recommended that parents ensure that your child is fully immunized and also receive that vitamin A from the age of 6 months up to the time that child reaches 5 years. Yeah, so in that way you will be preventing some of the condition. For example, deficiency in vitamin A can lead to a condition called xerophthalmia, that is a result of vitamin A deficiency. So it is very good for follow-up and ensure that the child is fully vaccinated.
Amazing.
Yeah.
Thank you so much. Because of that, it's of great benefit to a mother or a father with small babies right now. Getting practically now into this, what advice would you have for, first of all, a welder?
Yeah, so these are people who usually use most of the time work with the metals, and because of the welding machine, they are prone to injuries like penetrating injury of the eyes as a result of metal chips lodging in their eyes. So and it's also because of the welding machine, they are also exposed to bright light. So we encourage them to wear eye protectors and goggles because of that bright light, and eye protectors that those metal chips they are prevented from damaging the eye.
There is a very highly increased usage of mobile devices and computers. Statistics show averagely people are spending 6, 8 hours or 14 hours on their mobile phones, devices, and some on their computers. Ambapo light iko huko mwisho. What advice would you give to these users, and what are the side effects, and what should we do or not do?
Yeah, usually these are people who spend a lot of time in front of screens, especially the computers, laptop, phones, and we usually recommend that you control that brightness, because if you are going to spend 6 to 10 hours in front of that screen, when the brightness is full, you might end up damaging your eyes. And remember, you don't have an extra pair to correct those damaged eyes. So it is essential that we recommend wearing of anti-glare glasses. Anti-glare glasses, they usually prevent that excessive light from damaging your eyes. Yeah.
Wow. Now, and this one is tricky. What advice do you have for people that abuse toxic substances? For example, illicit brews. I remember there's a time some people consumed kitu ilikuwa inaitwa kali and their vision used to be ilikuwa napoteza macho. What advice do you have for that?
So, number one, it is a sad story. that in the name of enjoying oneself, we find some people taking that illicit brew. So it is highly recommended that we avoid such indulgence of taking illicit brew or any toxic substance, because studies have shown, and when it comes to eye condition, the eye is the mostly affected because of that toxic substances. And the part that usually affected most is where the image is formed, the retina and the optic nerve, causing inflammation in those areas. And the moment that eye is damaged, it's damaged forever. Because the moment that nerve is damaged, there is no regeneration of that optic nerve. So that nerve is gone and gone forever. So it is good to we take care of friends and relatives. We discourage this. We pray for them and take them for rehabilitation. Yeah.
Mtu anaweza kwa macho mpya. Maybe I don't know, like the way there's a kidney transplant.
Yeah, that's a good question. Currently, there's no studies or any procedure that can be used for eye transplant. Yeah, but because of that damage to the optic nerve, the moment that that nerve is gone, it's gone forever. It's damaged forever. There's no a replacement of that nerve. Yeah, so let us take good care of our eyes
right now.
Yeah, right now when the vision is very clear, I assure you take good care of that eyes. Yes, that's a gift from God.
Even minimal usage of phones and lights in case of maybe prolonged hours na kupunguza brightness, those are things can help.
Yeah.
Let's talk about exposure. There are some people whose jobs are good. We love jobs, but the job that they do comes with exposure to some dangers. For example, watu wa kuspray kama pesticides without helmet, without any protective gear, ama mtu anafanya kazi in environment ziko na tuseme kama moshi fulani yenye they don't know at that particular point when you are doing that job, that your health doesn't seem to get affected, but kidogo kidogo kuna complications zinajiform, then one day it becomes a big issue all of a sudden. How can we know that how can we assess, where can we start our assessment of our vision? Mtu anawezaje jua naona vizuri ama nimeanza kukua na kashita?
Thank you so much. So there are times that because of the nature of our business, of our job, we are exposed to such incidents where we come across pesticides, especially for farmers or people working in the farms. And we encourage that owners of the individual that owns that farm or even that employee to request for those eye protectors that can shield you from that spray, because some of this spray they can lead to chemical injuries, which is very toxic to the eye. Yeah, and other things we recommend that we ensure that you protect your eyes from further damage. So the moment you come across work-related eye injuries or environment that can predispose you to injury to the eye, it is good you take proper precautions. You can request for those eye protectors to protect your eyes, because your eyes, they are very important. That's the reason you're able to see or to work, because now you're able to see. And the moment that eyesight is gone, now it becomes another thing. You're not able even to work. Yeah, so it is important to take care of good of your eyes.
Thank you so much. And a very big takeaway is the way you insist that we take care of our eyes, the bodies that we have been given. Some of these things are irrecoverable. For example, the damage of the nerve ikienda unasema imeenda.
Imeenda.
Hey, I'm going to give you a chance to wrap this up to our viewer. Give to them in summary form everything that they should do for their eyes to reach like those of Moses. The Bible says in Deuteronomy 34 verse 7 that Moses was 120 years old when he died, yet his eyes were not weak, nor his strength gone. How do we reach this age of Moses with good eyesight in our lives? Ama kama macho ya our bishop. Our bishop is very far. Yeah, give us a summary.
So let me take this opportunity to encourage our viewers that immediately they notice those symptoms of the eyes, like photophobia, a person is afraid of light, or pain in the eyes, or foreign body sensation in the eyes, or itchiness, or reduced vision. It is and many other conditions that usually affect the eyes. Those symptoms, is very important that you go and see an eye specialist or an ophthalmologist, or you see a clinical officer specialist in that field, or you visit a health facility. You're able to direct you and connect you to the proper eye care services where you can receive treatment and ensure that you are able to prevent loss of that vision. For the parents who have little children, it is good to ensure that you monitor the way they are playing to avoid injuring the eyes, because the moment that eye is injured, it might lead to childhood blindness. So precaution is better than cure. So always ensure that you protect your eyes. Yeah.
Wow, amazing. Thank you so much because of that insight. Let us take our the gifts that God has given us of health seriously and take our body seriously. Don't consume illicit substances, kitu ambayo hujui inazuru hata mwili yako namna gani. Let us be serious. We give God all the glory, all the honor. He is the maker of all these organs that He has given us. The complexity of the eye as it is, ni Mungu tu anaielewa, na kuna venye ametengeneza mambo. It is mystery and wisdom. Ours is to do our part. Let us be serious about taking care of our bodies and ourselves. And we thank God because of the gift of life, the gift of sight, and even we continue trusting God for healing, even on those people with a condition of the eye right now. May you receive your healing in Jesus' name.
Amen.
He restored the sight of the blind. We have read it in the Bible now and again in the Gospels. He's still at work even today. Jesus can heal your eyes and restore you back to vision in Jesus' name. Take the necessary measures. Go back, even rewind the programs, sikiza hizo conditions tena, assess yourself well so that the doctors, it's the God who has given them the knowledge, can assist as God gives you the healing. We thank Bishop Dr. Thomas Mother and Reverend Phyllis Mother because of your labors of love. We thank you for your prayers. We thank you for your support. We thank you for this platform. Tunashukuru sana sana. I want to thank my brothers and sisters producing the Uchao Don't Break Show. Tukona Peter Maora, Elvis Ifuna, Doreen Mwende, Mungu abariki sana, together with the entire Prayer Cave TV staff. God richly bless you. Your labors in the Lord are not in vain. And to your viewer, we love you, we appreciate you, and we pray for you every day. My name is Eric Kimondo, and
I'm James Kyama.
James Chama.
Yeah.
See you.